Hey, welcome back to the Epilepsy channel. My name's Jeff, and today we're going to be talking about the difference between seizures and epilepsy. First, what is a seizure? A seizure is a sudden burst of electrical activity that causes a disturbance in the messaging between neurons. These bursts can cause temporary loss of consciousness, involuntary changes in muscle movements, awareness, sensations, and behaviors. A seizure can be a symptom of epilepsy, or it can be provoked by something else, like fever or low blood sugar. You have a 50% chance of knowing the cause of your epilepsy, like brain trauma or infection, developmental abnormalities, and genetic factors. Epilepsy is a condition of the brain that is characterized by repeated unprovoked seizures. Examples of provoked seizures would include febrile seizures, which are induced from high temperature, diabetic seizures from low blood sugar, and REM seizures from alcohol and drug withdrawal or misuse. Generalized seizures versus focal seizures. A generalized seizure involves the entire brain from onset, whereas a focal seizure only involves a portion of the brain, like the frontal lobe or the temporal lobe. In fact, temporal lobe epilepsy is the most common type of epilepsy among children and adults. Sometimes a seizure will start in one area of the brain and progress to involve the entire brain. This is called a focal to bilateral tonic-clonic seizure. Focal seizures include focal aware seizures and focal seizures with impaired awareness. Focal seizures have also been referred to as auras, simple partial seizures, and complex partial seizures. Generalized seizures include absence seizures, atonic seizures, clonic seizures, myoclonic seizures, tonic seizures, and tonic-clonic seizures. Treatment for epilepsy includes different types of medications, diets, different devices, and different surgical options. When a patient has tried and failed at least 2 anti-seizure medications, this is considered drug-resistant epilepsy, refractory epilepsy, or intractable epilepsy. Around 30% of epilepsy patients will have drug-resistant epilepsy. And then among this 30% of those will also have mesial temporal sclerosis, atrophy of the hippocampus. By the way, I'm epileptic. I'm not a doctor. This is just for educational purposes. Hit like and subscribe, and I'll see you in the next one.